Welcome to one of the most important videos on this channel. This applies to any type of injury you might have and for which you need treatment. Without it, you won't recover from your injury and your post-operative period will be very difficult. So stay until the end because this will make a huge difference in your treatment. The number one reason for a poor outcome after surgery or treatment for a nerve injury is choosing the wrong doctor. That's right, folks. People think that any doctor is qualified to perform any surgery. I'm going to tell you something I've never shared with anyone before. I saw one peripheral nerve surgery during my 6 years of medical residency in neurosurgery. However, today, I've already performed more than 3,000 peripheral nerve surgeries. Do you think I was a qualified specialist after finishing my neurosurgery training? Of course not. It was through a lot of study, a lot of learning, and many operated patients that I acquired the knowledge I have today. So, if a general practitioner tells you they're qualified to perform any nerve surgery, be skeptical. Especially that doctor who says that maybe the surgery won't work, and when you look at his face as he says he's going to operate, you can tell he's a bit doubtful about the outcome. He's being completely transparent with you. Even if he doesn't say it openly, he's doubtful about the surgery, either because he lacks experience or because he doesn't feel capable of performing the surgery, or worse, he's already done this surgery before, and the result wasn't satisfactory. Therefore, choosing a doctor who is qualified and experienced in the specific procedure to be performed is extremely important from this point on. Reason number 2 for the failure of a peripheral nerve surgery is physical therapy. That's right, folks. Physical therapy is extremely important. In fact, it's 50-50. The surgery accounts for 50% of the result, and rehabilitation is the other 50%. Imagine a patient who undergoes surgery for foot drop or a brachial plexus injury and is working with a good physical therapist, doing rehabilitation properly for 2 years. And another patient doesn't do any exercises, doesn't go through rehabilitation, and just waits for the results to appear out of nowhere. So, who do you think will succeed in this treatment? Exactly. Another important factor is that not every physical therapist understands peripheral nerve injuries. Most likely, they've never seen a patient who had the type of surgery you're about to have. So, what advice do I give you? Have your doctor talk to the person who will be handling your rehabilitation so that this connection becomes extremely important and helps guide the physical therapist to provide the best treatment for your case and your surgery. This will be an essential factor for your long-term results. The third factor, and one of the most important reasons for your surgery to fail and for you not to get results, is what? Not taking responsibility for your own treatment. Guys, here's some information that might be hard for you to hear, but from the moment of surgery on, everything that happens is your responsibility. There's no point in asking a family member to do an exercise for you, or asking the physical therapist to move your limbs while you just lie in bed, waiting for your arm, your leg, or your pain to suddenly get better on its own. You have to take the reins and steer your treatment in the direction you want it to go. And that depends solely and exclusively on you. In other words, create a routine, wake up in the morning, do your exercises, do your stretches, and take responsibility for your own results. No one in the world is more interested in a good outcome than you are. So don't put that responsibility on your family, your physical therapist, or your doctor. If you've chosen a good doctor, a good physical therapist, and your family supports you, from now on, the one who will take the reins of the situation and take the necessary actions is you. Factor number 4, exercising too much. That's right. Do you believe that exercising too much can actually lead to a bad outcome? Well then, in my experience, what I see is this. Some patients, especially those with brachial plexus injuries, right after removing the sling, start doing exercises several times a day. And then, in the first week, they go all out and do exercises. But by the second week, they've already given up on doing any rehabilitation. Do you know why? Because they don't see the results they were expecting. You need to understand the following. Exercises don't accumulate. Time is extremely important. In other words, the patient who does an exercise once a day is the one who gets better results than the one who does exercises several times a day and ends up giving up in the second week. So don't be that anxious patient who overloads on exercises and loses motivation after just a few days. Be the patient who is consistent and has a routine. He does his exercises every day for a period, then he rests and does other things in his life, and that's when he sees results in the long run. Number 5 reason for lack of results after surgery is not having a routine. That's right, folks, your life turns upside down after suffering a peripheral nerve injury. And living your life focused only on your arm or your leg, waiting for it to return to normal, makes you completely lose your routine and the direction your life had before. What do I advise you? Set aside a time of day to take care of your arm or your leg or your face, to do your exercises, eat properly, and take the necessary vitamins. However, after you finish that period, which is set aside for your recovery, you should do other things in parallel. You should take care of your house, take care of your family, take care of your work. In other words, you should treat one thing separately from the other, because we don't know how long it will take for your arm or your leg to get better, but we do know that your life can't wait for that to happen. Patients who don't separate their lives from the nerve injury they had end up becoming depressed, have trouble moving on with life, and then this ends up affecting the recovery of their arm or leg. Therefore, keep the two things separate. You will get the best result you can by doing things the right way. Your reserved period, your routine, and your rehabilitation. At the same time, your life goes on and you will keep growing. And this is tip number 6, not moving on with your life. Not moving on with your life leads to failure in treatment. Why? Because treatment is essential for your life to move forward, and your life is essential for you to be able to undergo treatment. So for you to do your exercises and have a routine, you need to keep living your life, you need to do your things, you need to take care of your family, you need to think about going back to work, and you need to have a reason to get up in the morning. When someone wakes up in the morning and looks at their arm and doesn't see any results, or sees that progress is slow, after all, the changes from one day to the next are so small, do you even feel like living? So you'll only feel like living if you get on with your life. Go back to work, help your family, help out around the house, do what you can to help yourself, because you know your family is there for you and you need to be there for them too. Therefore, moving on with your life is essential. If you like this video, and I said things that other people don't usually talk about, and you want more content to help you bounce back after a peripheral nerve injury, I'd like you to help me too by liking this video and following our channel.